Chronic inflammation is when it lasts for 3 to 6 months at a time, well beyond initial injury, and this is when inflammation can become problematic. Hey guys, welcome to another episode of the Dr. Akash Show. Now today I'm going to discuss something that affects 50% of the population worldwide and 40% of Americans that can lead to chronic disease states such as cancer, diabetes, Alzheimer's, dementia, and even heart disease. And that thing, my friends, is inflammation. We're going to discuss what inflammation is, why it occurs, what are the practical problems and considerations you need to be aware of in respect to inflammation, and then of course rituals and routines that you can develop immediately after watching and listening to this podcast to incorporate into your daily life to help minimize or hopefully avoid any sort of inflammation issues down the road. Now, as always, guys, if you have any value or if you gain any value from this podcast, please like, subscribe, and share and expose this to other like-minded people. This will also teach the algorithms to show this to more people like us. So let's get into it. Inflammation. If you look up the term inflammation in the dictionary, you're going to get something that sounds similar to this. A normal part of the body's response to injury or infection that occurs when the body releases chemicals that can increase the inflammatory response to heal and fight infection. So the key thing to take away from that definition is it is a normal response. It is something that is healthy and normal in our body. Now, typically inflammation is broken down on a timeline. Acute inflammation is what we typically see after an injury or an infection. Inflammation increases, which is basically your body's immune system being activated. The issue is either taken care of, the infection is cleared, the injury is healed, and then the inflammation goes away. Then there's subacute inflammation, where maybe it lasts a little bit longer. It's a prolonged duration of inflammation after the inciting incident has been taken care of. And then we have chronic inflammation. Now, chronic inflammation is when it lasts for 3 to 6 months at a time, well beyond initial injury. And this is when inflammation can become problematic. And this is when inflammation itself can turn upon our body, can become the enemy, because inflammation then can cause things like scarring of your internal cells, a change in your overall physiology, and ultimately all of this can kind of lead down the path, if not treated, to chronic disease states like cancer, diabetes, dementia, Alzheimer's, and even heart disease. And ultimately, the outcome of any of those, if left untreated, can be very catastrophic, as we all know. Now, what are some of the biggest practical problems when it comes to inflammation? Well, I would say one of the biggest ones that I typically see and hear about when clients reach out to me is pain, just physical pain, right? Because if you're dealing with an inflammatory state that's chronic, for example, this can manifest as pain. Now, that pain could be localized, like, for example, a spinal-based injury like sciatica or arthritic low back pain or neck pain, or even like an arm pain, like a shooting arm pain that's numb and tingly, and maybe even some weakness in the area. All of these can be manifestations of inflammation. Now, you can also deal with localized joint injury, like an aching knee or maybe an aching shoulder or a hip or something like that. The majority of times, practically speaking, when I see a client dealing with these focal specific complaints, it's due to inflammation greater than 90% of the time. The other issue you may notice with chronic inflammation is a decrease in movement. If you're inflamed and it's causing pain the way we've just described, you're going to be less inclined to move. You're going to be less inclined to stay physically active. And as we all know, the less physically active you are, the less physically active you are. Now, what I mean by that is you lose momentum. You lose the desire to keep moving forward, even psychologically, and it just becomes harder and harder to take that first step. Now, interestingly, there is data published that demonstrates increased volume and consistency of physical activity has a direct relationship to decreased biomarkers of inflammation. Meaning, basically, the more physically active you are, the more likely you are to minimize your chance of becoming inflamed. But it's a catch-22, like we've just discussed. Other issues with inflammation can be like a localized swelling or a redness, which is just kind of a localized area of pain and uncomfortableness, which can obviously be very distracting and can limit your ability to pursue your normal activities of daily living and just going about your day. And then, of course, ultimately, if the inflammation goes unchecked and untreated and it becomes chronic, this is where real problems lie. data demonstrates that chronic inflammation can lead to changes in your genetic makeup. It can lead to changes in your overall cell structure, causing changes in physiology. And all of this can potentially contribute to chronic illnesses like diabetes, heart disease, cancer, dementia, stroke, just to name a few. So this can be incredibly important. Not to mention the fact that when you're dealing with chronic inflammation and it manifests as chronic pain, this is not only physiologically exhausting on your body because your body is spending so much of its resources trying to fight the issue and kind of deal and manage with the inflammation. It becomes emotionally and psychologically exhausting as well. Feelings of helplessness, maybe even depression and other symptoms like this might begin to manifest, and hopefully not, but sometimes can take over your identity. So inflammation is incredibly important to deal with and nip it in the bud as early as possible before it becomes something that can literally take over your life. So if you're dealing with inflammation, or you know somebody dealing with these inflammatory issues and they've tried things and nothing's working, and you're starting to notice either in yourself or in your loved ones or a friend that they're just not who they used to be, and things are just, they're not as maybe full of joy and happy as they used to be, this is somebody who might be experiencing the direct or indirect effects of untreated chronic inflammation. So what can you do about it? Well, let's discuss some supplements that are scientifically proven and data backed to be helpful in respect to inflammation. Number one, the ginger family. So the ginger family includes ginger, turmeric, and an active ingredient within turmeric called curcumin. Now, these have all been shown to have active anti-inflammatory effects on the body, specifically with things like osteoarthritis, psoriasis, and inflammatory bowel disease. Next, consider omega-3 fatty acid. Now, these are typically found in high levels in fatty fish, and omega-3 fatty acids can be very helpful with what we call vascular inflammation, which is basically inflammation localized in the blood vessel. And where do the blood vessels go, guys? They go to the heart, right? So if you're dealing with vascular inflammation, most likely you're also dealing with some sort of cardiac issue or cardiac inflammation. And something like an omega-3 fatty acid, which has so many other cardiac benefits, can directly mitigate vascular inflammation, potentially slowing down the onset or hopefully eliminating the onset of any sort of chronic inflammatory cardiac disease. Next is zinc. Zinc has been known to be a very important ingredient to help boost the immune system and to allow your immune system to function at its utmost best. And when your immune system is functioning well, inflammation tends to be low. So zinc indirectly decreases inflammation by augmenting and supporting your immune system. But be mindful with zinc. It can be dangerous in higher levels. Ideally, the data suggests for males, you want to be at about 11 milligrams a day, and for females, about 8 milligrams per day. Be cautious if you're taking antibiotics or diuretics with zinc, because they can sometimes minimize the effect of those prescription type medications. Next is green tea. Now, green tea was initially discovered as a potent anti-inflammatory because it was noted that the regions that consume high levels of green tea in the world also tend to have very low inflammatory biomarkers. Now, green tea, the one thing to be cautious of here, it can mess with your overall folic acid levels. And if it does that, you need to be considerate of that in pregnancy, because folic acid is very important for neurological development of the baby. So if you're pregnant, be mindful of green tea intake. Other than that, it's a great potent anti-inflammatory. Next is S-adenosylmethionine, or SAM-E, SAM-E. Now, interestingly, this supplement is typically prescribed or recommended as an antidepressant, but this molecule, which is naturally occurring in our body, has shown benefit with not only depression, but also inflammation. And the thought is there's an inflammatory component that's contributing to that type of depression. So if you mitigate or eliminate or treat that, sometimes that particular type of depressive type symptoms may also change. This molecule, interestingly, also has a strong role in epigenetic function of our genes, which basically means it has a role to play in determining what genes are turned on and turned turned off in your body. The next one to discuss is boswellia or frankincense. Now, this is a naturally occurring herb in nature, which has been shown to decrease inflammation and decrease pain. It's also been shown to decrease cartilage loss, so much so that the Arthritis Foundation has actually stated that utilization of boswellia can decrease inflammatory changes caused by arthritis within 7 days. So very, very fast acting and very powerful. Ideal doses for this include a 30 to 40% extract of boswellia and then 250 to 300 milligrams 2 to 3 times a day. And interestingly with this one, if you take it in conjunction with curcumin can actually increase the potency of boswellia simultaneously. The next one to discuss is capsaicin. Now, capsaicin is what makes a hot pepper hot. So this is why sometimes spicy foods are actually going to be good for you when trying to fight pain or inflammation. The mechanism of action here is this blocks something called substance P. And basically, the more substance P you have in your body, the more inflamed and pain you're going to experience. So if you block substance P, you're going to have less pain stimulus. The next one is an herb called cat's claw. Now, cat's claw has been demonstrated to decrease a cytokine called TNF alpha or tumor necrosis factor alpha. By decreasing TNF alpha, you decrease inflammation directly. Now, what is a cytokine? Now, basically, a cytokine is a molecule that works in conjunction with your immune system to alter certain commands and responses and actions. Certain cytokines will increase inflammation caused by the immune system, and other ones will decrease it. I'm going to talk a little bit more about this in just a moment. And then, of course, there's traditional, more conservative pharmacological Western medicine techniques like over-the-counter or prescription non-steroidal anti-inflammatory drugs. This can include something like ibuprofen or Aleve or naproxen or something like that. In addition to that, there's cortisone-based injection therapies that can go directly to the source of the problem. Listen, these have a role to play and they're very useful when needed. However, they are prescription medications most of the time. They do have their own set of side effects. They are synthetic, so ultimately you want to minimize your exposure to those types of agents if you can, and really maximize the things that you can do for yourself by using the supplements we talked about and by incorporating certain rituals and routines to hopefully minimize your inflammatory cycle or your inflammatory pathway, so you don't need to kind of resort to these stronger prescription-based medications with their own untoward side effects. So guys, let's talk a little bit about rituals and routines that you can incorporate into your life immediately after this video so you can kind of take the bull by the horns and minimize your chance of dealing with a chronic inflammatory state. The first thing that you can do is weight-bearing activity or physical activity. Data has shown us that continued physical activity on a regular, consistent basis has a direct effect on decreasing inflammatory biomarkers. And I'm going to talk to you about biomarkers in a minute. So physical activity on a regular basis will decrease inflammatory markers. Number 2, hydration. Hydration allows your body's physiology and the functioning of the factory, the Ferrari that is your body, to actually work. If you're dehydrated, nothing works properly. So if you're dehydrated, you can still get things done on a physiological or biochemical level. However, it's going to be much more difficult. It's going to take much more time, and you're going to be left with much less resources at the end of the day. Stay hydrated, guys. The more hydrated you are, the better your body will function in all of these processes, including fighting chronic inflammation. Current recommendations are 3.7 liters of water for males per day and 2.7 liters of water for females per day. Next is sleep. Now, go back to a previous podcast where I really dive deep into sleep and we talk about certain rituals and routines to help your sleep improve. But your sleep needs to be on point. If you're not sleeping well, if you're not getting at least 6 to 7 hours, ideally 7 to 8 hours, your body never has a chance to play cleanup. One of the functions of sleep when your body is in that state is your physiology is going through and scavenging everything up, cleaning up your system, including inflammatory markers. So if you're never really caught up on sleep, your inflammatory cleanup process is never occurring, and that inflammation then begins to build and build to the point where it becomes chronic and very difficult to treat. And then ironically, it's going to mess with your sleep. It's going to make it even harder to sleep. So while you can, go back to that last podcast, listen to it, take notes, share it, and start incorporating those tips right away so you can get your sleep in line. Now, how do you know if you're doing a good job of maintaining your inflammatory markers? How do you know if you're incorporating all the things we've talked about today, if your inflammation is really under control? Well, thankfully, we do have certain laboratory results and certain lab values we can look at to determine your baseline inflammatory state today. And then once you begin to address this, you can note the improvement, because ultimately, if you're not measuring something, you're not really tracking it, right? So here are the inflammatory biomarkers that you need to look at. Number one, cytokines. As I stated earlier, cytokines are basically molecules that work with your immune system to signal certain activities. Certain cytokines to measure that can be indicative of high levels of inflammation include TNF alpha, which is tumor necrosis factor alpha, interleukin B, 6, 8, 10, and 12. Those are all interleukins to keep an eye out for. C-reactive protein is another one. Take a look at your C-reactive protein. This is a protein created from the liver that can actually be a signal on how inflamed you really are. ESR, or sedimentation rate, is another one. So ESR basically takes a look at the composition of your blood, because that composition changes when you're in an inflamed state. White blood cells. When you're inflamed and your immune system is up and running, your white blood cell count goes up. So take a look at your white blood cell count as well. Procalcitonin is another one. This is also created from your liver and also a great indication of your general inflammatory state. And finally, calprotectin. Calprotectin is also found in the white blood cells and also a good indicator of your overall inflammatory state. So rituals and routines, guys, for you to incorporate immediately after this video. Take a look at your hydration, your sleep, and your physical activity. Refer back to the guidelines I provided here and in previous episodes to go ahead and start those changes immediately. Number one. Number two, see if you can begin to incorporate some of the supplements that we discussed today into your daily regimen if you feel that you're in an inflamed state or if you're symptomatic. Number three, get a baseline level of laboratory results done, including what we discussed today. Resilience. Guys, as always, we always talk about what we can do to make sure you are able to cope with difficult situations, push through as quickly and efficiently as possible, and move forward in your life. The more you can adopt these rituals and routines, the less you're going to become physiologically exhausted, the less you're going to become emotionally and psychologically spent, the more resilient you can be. But it all comes down to making these things a habit. So incorporating these things will automatically make you very resilient. And of course, collectively, everything we've talked about today, in addition to the previous episodes that I referred to, especially sleep, will push you to becoming more of a robust individual, to becoming the 10.0 version of yourself, so you can maximize your power while you still can. But guys, don't forget, inflammation is not always bad. There are certain situations where you can use the power of inflammation. You can harness that power to actually accelerate the healing process. And this comes in certain regenerative type therapies, such as platelet-rich plasma, alpha-2 macroglobulin, and maybe even certain stem cell type procedures, which we'll get into all that in a future episode. But sometimes you can harness the power of inflammation to really accelerate the healing process locally. So guys, if you found any value in this episode, please like, subscribe, and share. I want to get this video and these podcasts out to more of a like-minded population, and it'll also teach the algorithms to expose this to more like-minded people. So guys, as always, the best time to start something was yesterday. The second best time is today. Don't look back tomorrow with regret. Take one small step today to pushing yourself to become maximally optimized. Thank you so much for watching the Dr. Akash Show.